everybody. I hope you can see my slides okay.
Yes, I can.
Thank you very much for the opportunity. I'm going to talk just very briefly for 5 minutes on the program that we're carrying out in the Caribbean region, where we're developing a climate change and health fellowship program. So this is slightly different to some of the things that you've heard earlier. What we're doing, like many of us, is we're strengthening climate resilient health systems. And we're doing this in the Caribbean. And this is part of actually a wider project, which is the European Union funded and PAHO implemented CARIFORUM climate change project involving 6 locations across the Caribbean. And our main topics that we're addressing is climate change and health leadership using a One Health interdisciplinary model. So it's a very large project for 7 million euros, and it started in June 2020 and will go on for 5 years. So here you can see the 16 Caribbean countries that are going to be benefiting from the project. So the larger project is called Strengthening Climate Resilient Health Systems in the Caribbean. I'm going to be talking today about this component here on leadership. But it's important to say that there are other pillars to the project which are very, very important, including measuring health co-benefits and mitigation here, and developing surveillance and risk monitoring, early warning systems, putting health into national adaptation plans, and of course promoting awareness around the Caribbean. But today I'm going to talk about the fellowship program that we're developing. We're really aiming to develop we're targeting early to mid-career professionals, and we're aiming to develop a cohort of change makers across the Caribbean region. And our problem, as many of our problems are, is that regional health systems and populations remain highly vulnerable to the impacts of climate change, which you've heard about yesterday. And we really need local leaders and local practitioners to lead the change and to lead the process. So our solution is to develop this cohort and network of climate change and health practitioners, with the knowledge and skills to become agents of change in the region, to really lead the process of change across the Caribbean, both regionally and in their home countries. And we'll be very much promoting the interdisciplinary One Health approach, including linkages to the environmental and social determinants of health, which we've heard about. So we've been working hard over the last 6 months, and we have developed the program, we've developed the fellowship curriculum, and we have, through a competitive selection process, we have actually recently selected our first cohort of 6 fellows. We had 87 applicants, and we've whittled them down to 6 here, and we have a mixture of a very exciting group with very many different skills and expertise, some in the Ministry of Health, some are in the Ministry of Environment, some medical doctors, who all have a real interest in climate change and health and making a difference and moving the process forward in their home country. So we have Haiti, Barbados, the Bahamas, St. Vincent, St. Lucia, and Suriname represented. And we have developed a curriculum, and this is a very adaptive curriculum. So because every fellow is different and every group of fellows is different, so we plan to adapt the program as we move forward so we can best address the needs of the fellows. We also plan to have a big focus on peer-to-peer learning, and also learning by doing, so people actually doing things. So it'll be a part-time 12-month blended learning fellowship with a kick-off workshop at the start and a summative workshop at the end, which we hope to be face-to-face, obviously not this year. And we will have online themed weekly sessions in blocks in the 12-month period. The first block being focused on building comfort and credibility in climate change and health issues, then building change agents and leadership skills, getting ready to lead, and sustaining change. And throughout this process, the fellows, I talked about learning by doing, they will be lead on a nationally relevant climate change and health project, which is related to their national adaptation plans. They will lead a workshop symposium in their home country where they'll be working with youth leaders and bringing in stakeholders in climate change and health in their country. And they'll have the opportunity to spend a week in one of our CARICOM climate change and health regional agencies to really deep dive into an area that they're particularly interested in. Let me just change that. So what about the challenges and the lessons learned? Well, we ran at the UE, we ran a large project called One Health, One Caribbean, One Love recently, and we learned a lot from that. This was another EU project. And we learned the importance of having a very rigorous selection process and interview. So you really can select the appropriate candidates with the enthusiasm and the positions to be able to maximize the opportunities of the learning from the fellowship. Also critical to have permission from the immediate supervisor employer, because it does take time to do this fellowship. So that permission is very important. To have mentors and coaches with a very Caribbean focus, and have the teaching and learning interactions organized between the modules, so we keep the momentum up. So this is what we think is really critical as we move forward. And the next steps with this fellowship program, which is extremely exciting, we're going to be engaging with larger Caribbean climate change and health communities. We can really be inclusive across the whole region and bring in expertise from across the whole region to contribute towards the fellowship, and across all the UE campuses as well. We'll be running 4 cohorts of 6 fellows, which will incorporate the 16 eligible countries, and we'll be very importantly carrying out monitoring and evaluation to fine-tune the program in real time as we move forward. And we'll seek out linkages with the EU CARIFORUM partners. And with what we aim to do is to build this network of climate change and health practitioners and leaders, these agents of change, that really take these reports off the shelves and are actually doers. They're acting, they're actioning the program. And finally, we are very, very keen to ensure the sustainability of the program beyond the funded project, and we're working towards developing it into an online format. Thank you very much.